They require us in order to make progeny. We are their source of energy, their source of food. They wish to reproduce. They cannot do it unless they are in our bodies and in our cells. They use our basic building blocks to make their basic building blocks and to build their structures. And they've evolved over millions of years and eons of time to do this in a way that we can't detect. It absolutely is warfare. These technologies allow us to predict and see their activity before they even get inside us. And that is why the sampling of wastewater is such an attractive area for public health, because it is a communal repository, right? So we are not sampling one or a few individuals. We are at any given moment assessing the total activity of tens of thousands to millions of people. That type of quantitative power and statistics and scale gives us a lot of computational data that we can work with to make predictions and get ahead of what's happening. Wastewater-based epidemiology is the idea that you could sample wastewater and analyze wastewater for substances or microbes that might impact human health. It had its origins in the 1930s and 1940s in the detection of poliovirus. So some scientists on the East Coast developed the concept that you can analyze wastewater for polio, and that may tell you where outbreaks are going to occur. And some of the earliest indications of the use of wastewater-based epidemiology was to monitor polio in the city of Houston. And so some scientists at Baylor College of Medicine, namely Dr. Melnick, who is the chair of molecular virology at Baylor, was sampling for wastewater looking for polio levels and noticed that the levels of the virus were increasing in the summer of 1962. And he convinced individuals to move up the administration of the oral polio vaccine based on what he thought was going to be a very bad polio season. And so this is one of the first ever indications of the use of wastewater-based epidemiology for public health intervention.
Really was fairly primitive. The first phase that was developing methods to concentrate and test for viruses in water is really what the initial technology was. What really makes wastewater-based epidemiology practical is you can get results within a day, where it used to take weeks, because everybody knew you could find viruses in the water before you see the clinical disease in the wastewater. And so what it really took was the molecular biology, because you could sample in the morning and get results in the afternoon.
We've seen this over and over again. We had the 2009 H1N1 swine pandemic. We had basically the initial SARS, the 2003 SARS. Then we had the MERS. And so we should be relatively well prepared, but we're not. And so wastewater, I think, surveillance really has augmented our capabilities, because from my perspective, it is able to encompass at a population level relatively inexpensive surveillance and be able to monitor for pathogens that we may not routinely monitor for. And so I think wastewater is one armamentarium for our ability to truly be pandemically prepared.
So TEPHI, or the Texas Epidemic Public Health Institute, was founded by the state legislature with the goal of really helping better prepare Texas for future infectious disease outbreaks. We work with partners across the state. We're not responders, but we're helping prepare Texas. Wastewater data is is unbiased in the sense that you get a true picture of what's happening in the community. If we can identify pathogens in our communities earlier, it gives local public health officials and the public more time to respond and more information with which to respond. Also, with their input, we were able to develop a statewide survey that went out to local public health officials across the state and ultimately created a report that now goes out weekly to all our participating municipalities with information on what we're seeing in their wastewater.
We're doing way more with TEPHI, just way more than COVID-19. We're doing all sorts of different organisms, most of which have direct and helpful implications to the local community of physicians.
There are a lot of stakeholders and a lot of them speak different languages. So you have your utilities that you have to engage and work with. You have your basic scientists and your data scientists. You have your local public health practitioners. You're engaging a whole host of different stakeholders to make this work.
So sequencing technologies. Many people have heard of these. We sequence human genomes, we sequence animal genomes, plants, all types of microbes. We've just adapted this technology to the analysis of wastewater.
When we started to come out of the COVID-19 pandemic, we saw a number of people that were using wastewater surveillance to look at the levels of SARS-CoV-2 across time, maybe expanding into flu or RSV or a few other pathogens. We are covering 12 pathogens, which is much broader than most anyone else does, but what makes our efforts at UT Health and within TextWeb unique is this introduction of this agnostic viral sequencing, where we can look at all these known mammalian and human viruses, and this becomes something that is really pushing the lines of the field. It is technologically driving what we're doing and is bringing together our interactions with our public health partners and really starting to define how we look at this and how we start to understand how these viruses are transmitting and circulating within our communities.
Because they're so small and the way they transmit, we can't visually see them. So we are essentially operating in the dark for our understanding of their mischievous maneuvers, right? But sequencing allows us to put a bright spotlight on what they're doing behind the scenes. And it's just about being able to interpret what we're seeing fast enough to be able to have actions that could get ahead of their moves before they cause real problems.
I think there's a lot of really strong indication that these networks really work. Things like GISAID to be able to understand what influenza, what SARS-CoV-2, Mpox to some example, are circulating across the globe has let us understand what new variants may be coming down the line. This also allows us to understand how we may need to adapt our vaccines to what is circulating currently. And there's a lot of opportunities, not all of which we're doing yet, but things that we want to continue to explore with our public health partners and really see how wastewater surveillance starts to become a large piece of that puzzle and continues to enable our response and our preparedness.
I think one of the biggest fears that at least I have is after a pandemic and after people have put a lot of time into a particular, let's say, type of technology, and wastewater monitoring would be an example, is that people lose interest because the pandemic is no longer there and other interests all of a sudden start taking priority, which means that we let down our defenses.
We can do epidemiological studies now we could never even dream of doing before, because we can monitor thousands of people at one time, where we could never take thousands of samples of individuals at one time. So the whole area of that wastewater epidemiology is going to have a major impact, I think, on health interventions and analyzing the success of them.
Expanding this work across Texas will give us a vital early warning tool in our public health arsenal and will give our communities crucial time to prepare and respond. TEPHI's work is ultimately going to ensure that our state will be better prepared for the next outbreak or epidemic and will keep our communities safe and the Texas economy strong.